All right, so this will be a quick one, just a video recording of what we're doing for the inaugural webinar for the Consultation Liaison Special Interest Group on Wednesday night, which is about liaison in a time of COVID. It's probably irrelevant to have a Queenslander talking about this now, but anyway, too late, I'm invited. And I just want to run through a little bit of data and a couple of points. First bit of data is Queensland doesn't really compare very well to the other Australian states and territories. We're a fair bit bigger than the smaller states and territories, and not quite up to the mark for Victoria and New South Wales. So it just so happens we fall in the middle of these other countries. I'm no epidemiologist, I can't even say the word, let alone do the job, or a public health expert. So I think comparing by population alone probably isn't a very robust method. But anyway, look, I just stumbled into this data, but it's easy to imagine that because of the square kilometres that each of us have and other differences between societies, that this is quite potentially a dodgy comparison. Nevertheless, let's go ahead and do it. So Queensland's population is a couple of 100,000 more than New Zealand and a few 100,000 less than Singapore, with Ireland and Norway in between there. The data I'm going to present is all true and correct as of the 1st of August, which, as you know, is the horse's birthday here in Australia. And it's interesting to see that Queensland, even though we've got a larger population than New Zealand, actually have less cases. And that's kind of encouraging for us Queenslanders to know, because New Zealand is held up as being a shining example of how to manage COVID. We're doing a little bit better. Not that it's competition, not that it's competition. Amazing to see the data there for Singapore, isn't it? That's really high. Keep an eye on that. So Singapore has got twice the number of cases as they do in Ireland, who have more than twice the number of what they do in Norway. Just look what happens with this next graph here, which is about the COVID-19 deaths. Now, I don't want to make light of this. There's thousands of grieving families out here, but isn't it amazing if you look at the super low death rate for Singapore and by comparison that really high death rate in Ireland? I don't know enough about any of this stuff to give an explanation. I could speculate, but I'm not going to do it on video because it might come back and bite me on the bum that when people find out how stupid I am. The other thing I just want to bring your attention to again is that even though there's half a dozen families who are mourning the loss of a loved one here in Queensland, that's really good on a world scale, even compared again to New Zealand. We're doing super well up here. And then again, looking at the 1st of April, with the spread of the new cases, Queensland again is doing really well, beating out everybody else. Singapore's really struggling at the moment. Ireland not doing all that well. Norway are getting a similar sort of rates of infection as what New South Wales has been getting lately. Here in Cairns, we've done really well. We've only had 37 cases all up. All of those people have recovered. We haven't had any deaths in Cairns. About 30% of our hospital inpatients here in Cairns come from our neighbouring health district, the Torres, and as in Torres Islands, and Cape as in Cape York Peninsula. And it's great that there's been no cases up there. And that's really important because there's a lot of mostly Indigenous towns up there, a lot of places where the Aboriginal and or Torres Strait Islander population would be over 90% of the community. And those communities during the Spanish flu, going back 100 years, as we all remember, but those communities really got slammed with the Spanish flu. Some of them had like 50% mortality. So that there's been no cases up that way is just fantastic. Really, a really good news story. Just going to briefly touch on two strategies that we've done here in Cairns. The first one was trying to lock in the management of anxiety for us clinical staff in with our everyday practice. So we spoke a lot about how do we manage our anxiety. Of course we're anxious when we were gearing up for the onslaught of referrals. And one of the things that we came across and I spoke about a bit was building in mindful moments to our everyday clinical practice. So every time you wash your hands, you slow down your breathing, you check in on yourself and make sure that your hands and yourself are feeling safe as you go on. And that had a fairly good bit of uptake. The other thing is that we spoke about was around PPE, of course. There's a lot of concentration on that. And I got to chat with some young, really impressive nurses on a couple of the wards that pivoted from being a surgical ward to a COVID ward. And we were talking about what are the good things that have come out of all these preparations. And so we framed that up as the other PPE, the positive practice environment. And what they spoke about a lot was team nursing. And so when you were going into a room by yourself, you weren't really by yourself, you were always buddied up with another nurse who checked you with your donning and doffing of PPE, was available quickly and easily. If you were in there and you needed something else brought in, you could grab them on the phone really easily. Communication within the team, the nursing team, and between the nursing team and the infectious diseases team was really good. Everybody spoke about how well the team gelled and were communicating. Lots of great ideas about working smarter. The ones that stuck in my mind were they wrote the extension number for everybody's, for the patient phone, the bedside phone, on the glass window of the door to their room, as a reminder that you could phone easily. You didn't have to get all dressed up to get information from somebody. I never saw somebody in wearing PPE. I did all my reviews of suspected or confirmed COVID patients through a window using the phone. They also changed the phone, so if the patient picked up the bedside phone, it automatically rang the nurse who was allocated to that room, and that was super handy too. And the nurses would also phone through to the phone and say, look, I'm going to be coming in 5 or 10 minutes. Is there anything you want me to grab you or do before I come in? So that was really good. Getting smarter, they were talking about, like particularly on the surgical ward and also the older persons ward, who also pivoted to being a COVID ward, is that they're all very aware that they didn't really know much about nursing in a pandemic. Who does? But they found out lots of information through nice reputable sources. They got it directly from the ID guys, the infectious diseases guys, or from the policies that were being handed down from Queensland Health Central thing. And staying focused, part of getting smarter was not looking at every bit of data or information coming around. There was a fair bit of rubbish, still some stuff filtered through to our emails at work, and not all of it was great. And also staying clear a bit of social media and stuff, so you don't get too clouded with what's going on elsewhere, was really important. And overlapping with that, they spoke very much about how downtime is sacred, and that it was really important when you're away from work is to take your head away from work and not to be talking and thinking about COVID all the time. And we thought that was really smart. That's all I wanted to say. If you want to look at any of this data in a bit more detail, you can just go straight to this website and that'll take you there. And that's it. Thanks for watching. Cheers.